Welcome to this special edition of Conversations on Cannabis, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. I'm Heidi Otway, and on this program, we're talking about cannabis and mental health. Our guest is Dr. Gwendolyn Singleton, an associate professor and director of the Center for Ethnic Psychological Research and Application at Florida A&M University. Dr. Singleton, thank you so much for being a guest on Conversations on Cannabis.
Thank you for having me, Heidi. It's my pleasure.
So with the November election, the pandemic, and the upcoming holidays, it's safe to say that many Floridians are probably going through a tough time mentally right about now. Can you share some of the most common types of mental health disorders that people could be experiencing?
Yes, that's a really good question. So common mental health disorders that individuals typically experience, things like depression, anxiety, obsessive compulsive disorders, post-traumatic stress disorders. Honestly, the CDC actually conducted a study between April and June of this year, and something they saw that there was a significant increase in mental health challenges, specifically related to anxiety and mental health concerns from that time period in this year compared to the same time period last year. Individuals reported also, in addition to the anxiety and depression, increases in trauma and stress-related disorders related to the pandemic. And substance use, which people don't typically think about as a mental health concern, is also included. And there were increases in use as well as in the initiation of substance use due to COVID. Another thing that they identified were increases in suicidal ideations. They found significant increases across the board, but notably in individuals between the ages of 18 to 24, African Americans, Hispanics, frontline workers, and caregivers. This is really a serious time, and it really concerns a number of individuals, and it is manifesting in mental health challenges.
Wow. So let's talk a little bit about the substance use that you just referenced. Did they specifically give any lists of the kinds of substances that folks are misusing right at this time or using more than before?
Among those were alcohol, marijuana.
Legal marijuana or the recreational that's illegal in Florida?
Right. So, I did not see a distinction. It said marijuana on the list, but it did not make a distinction between prescribed versus recreational.
Okay, that's really, really interesting. So as an educator and as a researcher, what are you seeing and hearing about medical marijuana as a mental health treatment?
Well, there's a lot of research that talks about the effectiveness of the use of medical marijuana for pain, for anti-inflammatory conditions, anxiety, psychotic disorders. And so there's a lot of research out there that's talking about benefits, but then there's also research talking about poor outcomes. I actually conducted a study looking at medical marijuana, examining mental health and neuropsychological outcomes. And we found that individuals with poor mental health, and that included coping, anxiety, and some of the other things we just talked about, as well as poor neuropsychological functioning. So their thinking or cognitive processing, along with emotional regulation, they were at a significantly increased risk for misusing marijuana. There's other research that talks about increases in anxiety, psychosis, respiratory problems. A lot of individuals feel that using marijuana would help them to relax, but it actually, the research suggests that there may be some initial relaxation effects, but then there's like a rebound effect where then there's a high level of anxiety, and then the individual is likely to self-medicate, according to the research, to then use more to reduce the anxiety, but then there's this vicious cycle where they're continually increasing their levels of anxiety. They may have that initial reduction, but then it rebounds. So there are a number of issues. And actually one other thing, so some other individuals feel that, we hear this a lot, using the marijuana makes them more creative, but the research says it does not. There's no evidence that it improves creativity. The individual may produce some unusual or ideas that they feel are extremely creative. However, the research says that marijuana does not increase their production of creative ideas, nor the use of those ideas.
Right. And I guess, in that research, were they specifically talking about recreational use versus medical? Because the medical does not have the levels of THC that could cause the high.
That is correct. That is correct. So it's primarily for that, and looking at creativity, it was primarily looking at recreational marijuana.
And that's illegal in Florida. So what's legal
Correct.
in Florida is medical marijuana, and folks need to go through a doctor to actually get access to that. And have you heard or seen, I've been reading the numbers about the number of cards that are being sold in Florida, not sold, but purchased in Florida, the medical marijuana cards. And there has been a significant increase since the pandemic began. What are you hearing about more people getting access to medical marijuana to help with their mental health issues?
Right. Yes, there has been an increase of individuals who are seeking prescriptions to get the medical marijuana card so they can use it legally. And it has been associated with those increases with anxiety, depression, and the trauma and stress related disorders that the individuals are experiencing. What we've seen a lot, and there have been a lot of reports actually across the world, not just in the United States, not just in Florida, an exponential increase in feelings of overwhelm, anxiety, stress because of all of the uncertainty, all of the loss, the death that's surrounding the pandemic. So yes, this is something that's seen nationwide and worldwide in terms of increase of the need for some type of medicinal substance to assist in dealing with these mental health challenges.
Yeah. So, some of our listeners and viewers may not be ready to get a medical marijuana card. And for those who are considering it, I would recommend that you go to the Florida Department of Health's Office of Medical Marijuana Use, OMMU, which provides a lot of information on how to legally obtain a medical marijuana card in Florida and the process and steps that you can use to get that information. And then I would also encourage them to go to the Florida A&M Medical Marijuana Education and Research Initiative website to also get information about medical marijuana use in Florida. So Dr. Gwendolyn Singleton, I wanted to ask you, what are some actions that folks could take to improve their mental health if they're not yet ready to try medical marijuana?
Okay. I would always recommend starting with a physician, just in case. We want to make sure, you get that physical exam. They may even do some mental health screening, just to ensure that there are no other underlying medical conditions that could be contributing to the symptoms that they're experiencing. That's always a good place to start, as well as a mental health professional. But if they're cleared, there are no other underlying conditions that are contributing and they're not ready to get a medical marijuana card. However, they want something to assist them in managing their symptoms. On top of the list, I would say healthy lifestyle practices, including creating a self-care plan. And a self-care plan is it's a plan what you're going to do daily to take care of yourself. Physically, so for example, eating, exercise, sleep. Psychologically, things like self-reflection, maybe journaling, noticing, your own feelings, emotions. So being aware of what you're feeling. There's emotional self-care, things like self-affirmations, self-love, something we don't think about a lot, but being intentional.
Right.
Yeah, in our efforts for in loving ourselves. Also allowing ourselves to cry if we need to. And something else I want to add there, and surrounding ourselves with positive people. It's always important. That helps our emotional stability, but also that's an important part of our emotional self-care. There's also spiritual self-care. It's for some, this is religious, some it's not. So it could be spending time with nature, meditating, singing, contributing to an important cause. There's relationship self-care. So with friends or your partner or spouse, whatever regular activities that you're going to do to nurture yourself and nurture your relationships, dates, things like that. And then there's also professional self-care. A lot of individuals throw themselves into work. This is great for being productive. However, it's not great for self-care. It's important to take breaks. It's important to organize your workspace, to prioritize, know when to say no. So having these different things laid out. So daily, what am I going to do to take care of myself? And adding other helpful coping strategies, problem solving, seeking support, relaxation, all those things just on a regular basis to help make sure that we're taking care of ourselves.
Yeah, in communities of color, we hear about the stigma of talking about or expressing mental health concerns that a person may have. Can you talk a little bit about, the work that you do, or in your practice, your academic work, just how people of color could, get the help that they need, or to have these kinds of conversations that they may feel uncomfortable having because of the stigma around mental health?
Yes, Heidi, that's a great question. In our community, there is a big stigma around mental health and mental illness. So we've launched numerous campaigns calling to stop the stigma. Because mental illness, just like a physical illness, is an illness. It has a biological basis, it has a neurochemical basis. So there is an imbalance in the brain functioning, neurochemicals, neurotransmitters that are being released. And so our behaviors, our choices, and sometimes medication, if a physician says so, will help to restore that balance. So a good place to start is knowing that this is not a sign of weakness. It's not a sign, it's not crazy what people say so often. It's an actual illness. And telling someone to just snap out of it will not work, because it's not going to restore the balance with those neurochemicals. So we need to provide the support, supporting the individual in engaging in helpful strategies to restore their or maintain their mental health. If that doesn't work, then definitely seeing a physician or mental health care professional, and remove any judgment, any stigma. A lot of times it starts with us. Sometimes we, are harder on ourselves, assuming that something's wrong with us, or that it's a weakness, or that it's something negative, but it is not. Just with any other condition that we experience, this is a condition for which there is always hope, there's always help, but we need to seek that help, and we need to maintain the hope and maintain our engagement in the process and our efforts to improve our mental health. A lot of individuals in our community are church-based, but there's also church-based counseling. So then there's also spiritual counseling, where a pastor or another trained person can provide counseling.
Yeah. So what other resources are out there for our listeners and viewers to get information about different mental health disorders or support?
Okay. So again, I'm always starting with the physician. Your primary care provider can provide information on mental health as well, but also websites like the American Psychological Association, which is apa.org. Positive Psychology, which is positivepsychology.com, is another helpful site. NAMI, we have a local organization of NAMI here, which is a National Alliance on Mental Illness, and they're NAMI.org. There are also another helpful resource, especially for times of crisis, will be the National Suicide Prevention Lifeline,
Yeah.
which is 800-273-TALK. That's 800-273-8255. There are also apps that are so helpful out there. I've had students.
What's your favorite? What's a good one that folks should try out?
I really like Breathe to Relax. It takes you through an exercise of just breathing. It helps you to pace your inhalation and your exhalation, because a lot of times when we're feeling stressed, anxious, overwhelmed, our breathing becomes shallow. And so we're not getting enough oxygen. So it creates a feeling of panic. So then when we slow down the breathing and we regulate the breathing, it produces feelings of calm. So something just that simple. There are also nature sounds. Sometimes if I've had a really busy day and I'm having difficulty shutting down all those thoughts, my to-do list, what I'm going to, what I didn't do and all that, listening to those nature sounds are really helpful, because it takes your mind away from all of those things that are troubling you or that are just occupying your mind at a time when you should be resting.
That's some great advice. I think I'm going to try all of that this afternoon because my brain is always going so fast.
Yes.
Dr. Singleton, thank you so much for being a guest on this special edition of Conversations on Cannabis. Is there anything else that you'd like to share with our listeners and viewers at this time?
Yes. So I'll say, there's research out there talking about the benefits of medical marijuana, THC, and there are reports that marijuana in and of itself has benefits. But I would definitely caution use and misuse, because a lot of the research out there is focused on THC and CBD, but there are numerous other compounds in marijuana that need to be researched further, especially in African American populations. I referenced my study earlier, showing that there are challenges with mental health and neuropsychological outcomes, and this was in an African American population. There's some research talking about the effects of melanin and how melanin in our system impacts how we respond to treatment. So anyone with a prescription, I definitely urge you to also think about, as with any other prescription medication, there's a potential for misuse, there's a potential for side effects. So it's really critical that you continue to work very closely with your physician, with your mental health care providers, to make sure that you're monitoring your symptoms. I also recommend having an accountability partner. That's something that is also recommended with the self-care plan, but with the prescription medical marijuana, it's also helpful, so that if someone that you know and care and who cares about you is also assisting you in monitoring your symptoms, then it's unlikely that things will get to the point where you are in a critical state where there's potential for long-term damage. So I encourage you to maintain contact with your physician, your mental health care professionals, create a self-care plan, including an emergency self-care plan, something like, what am I going to do when there's an emergency? Who can I call? What can I do? And I encourage others to stay informed. Make sure that you are knowledgeable about what you are taking and what you're doing and its impact on your life.
Yeah, those are all great tips. Dr. Singleton, thank you so much. We really appreciate you being with us.
Thank you. It's my pleasure.